Welcome to another edition of Cancer Facts with Dr. B. This month is not only Black History Month, but it's Cancer Prevention Month. So today's question is, what can I do to lower my risk for cancer? The first thing you could do is talk to your primary care physician to determine your genetic risk and your need for a genetic evaluation. Other things such as lifestyle changes such as weight control, exercise, smoking cessation, consuming cancer-fighting foods and drinks, avoiding foods and drinks that can increase your risk, the use of sunscreen, and vaccinations. So let's look at case number 3. This is a 60-year-old African-American woman. She has a first cousin diagnosed with breast cancer at the age of 60. She has a BMI of 29. She does not exercise. She drinks a glass of wine every night. She had her first period at the age of 15 and reached menopause at the age of 50. She was pregnant 2 times and gave birth to 2 children, with the first one born at the age of 23. About 5 to 10% of breast cancer cases are thought to be hereditary, meaning that they result directly from gene changes or mutations passed on from the parent. Therefore, at least 90% of breast cancers occur in women without a known familial genetic mutation, and 80 to 90% have no family history among their first-degree relatives. There are many times I hear my patients say they did not get mammograms because they did not have a family history of breast cancer. But women, even without a history of breast cancer in their family, should get routine mammograms because most cancers are what we call sporadic, or they just happen. So the first thing we do is use the NCCN Guidelines Familial Risk Assessment Chart to determine her need for genetic testing. This is important not only for breast cancer, but also for other cancers such as ovarian, pancreatic, colorectal, and other cancers. She does not meet the need for genetic testing. However, based on the Tyrer-Cuzick probability model, she has a 6.2% risk of developing breast cancer in her lifetime. This model takes into account her age, BMI, exposure to hormones, and family history. A combination of weight, physical activity, diet, and alcohol can account for at least 18.2% of cancer cases and 15.8% of cancer deaths in the United States. Approximately 10.9% of cancer cases among women and 4.8% of cancer cases among men result from being overweight or obese. In the United States, 80% of African American women are overweight or obese. So because she does not smoke, the most important thing she can do to reduce her risk for cancer, as well as a whole host of other medical problems, is to lose weight through a proper diet, exercise, and getting enough sleep. Approximately 4.4% of cancer cases among women and 1.5% of cancer cases among men result from physical inactivity. To summarize, in order to reduce your risk of cancer, talk to your primary care physician to determine your genetic risk and your need for a genetic evaluation. Lifestyle changes such as weight control, exercise, and smoking cessation can also decrease your risk for breast cancer. About 40% of all cancers are linked to tobacco use. Over 5 million cases of non-melanoma skin cancers occur in the United States, and almost 80,000 cases of melanoma occur. The regular use of sunscreen can cut this risk in half. However, skin cancer makes up only 1% of cancers in African Americans. Consume cancer-fighting foods and drinks. Avoid foods and drinks that can increase your risk. Volumes and books have been written regarding the impact your diet has on developing cancer and its relationship to your weight. It essentially involves eating plenty of vegetables and limiting your amount of red meat, processed meats, smoked meats, processed foods, and alcohol. And finally, vaccinations such as the HPV vaccine and the hepatitis B vaccine also decrease your risk for getting cancer. Thank you, and again, feel free to leave comments or questions on the website.